Welcome to the Health Channel, all health, all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios in Coral Gables. You know, you hear a lot about how to protect your skin from the sun's rays, but there are many simple health moves that can kind of help your exterior layer stay in fabulous shape. And that's what we want. And with me today to talk about skincare is Dr. Michelle Brewster and Dr. Nina Dieguez, both internal medicine physicians with Baptist Health South Florida. Welcome.
Thank you for having us.
Thanks for being here. Well, you know, we live in the Sunshine State, right? South Florida.
Absolutely.
We are, how does the song go?
Here comes the sun, every darling.
Here comes the sun, and I say, you don't know it, do you?
It's all right.
And it's all right. It's all right to get a little bit of sun now and then, right?
That's right. However, we must practice skin protection, absolutely, from the sun, because it can do a little damage. So we'll get into that more.
We are, and we all know that your skin plays a vital role in protecting your body. So what are some steps to promote skin health? Let's first start with the National Institutes of Health and what they recommend. Take a look.
Isn't it amazing how something 93 million miles away can be so important to us? It's no wonder that many cultures have idolized the sun as a god. But just like a mythical god, the sun brings both beauty and danger. You may see a tan now, but you could have a burn or premature wrinkling and skin cancer later. This video will help you learn more about how to avoid the sun's wrath. The sun helps your skin make vitamin D to keep your bones healthy, keeps your mood elevated, keeps your sleep schedule regular, and even grows the food and nutrients you need to survive. But too much sun can lead to sunburns and other damage you can't see. In addition to visible light, the sun makes UV or ultraviolet light. UVB rays will often cause a tan or sunburn, while UVA rays go deeper and can damage your skin's natural growth, repair systems, and overall appearance. As you age, it's naturally harder for the skin to repair itself, which is why you get wrinkles and lines. If you get too much sun, you can speed up this process, so your skin ages earlier.
The outer layer of the skin gets the greatest sun exposure, but the deeper layer is composed of proteins that will strengthen the skin. These proteins get damaged by the persistent sun exposure. Instead of giving a nice, strong, clear skin, they'll break up and give you the wrinkles, and that's the deeper layers of the skin.
Eventually, all that sun exposure can lead to skin cancer, the most common type of cancer in the U.S.
Examine the skin and make sure that you're aware of what type of lesions are present or not present. Freckling may be very prominent in some individuals. Particularly concerned about pigmented lesions, brown or black lesions, or those with irregular size or shape.
The best way to protect yourself from the sun is to wear protective clothing and to cover up. But using sunscreen is a great way to enjoy the sun and still protect your skin. A sunscreen with an SPF or sun protection factor of 30 means it would take you 30 times as long to burn. Apply sunscreen 15 to 30 minutes before sun exposure and apply generously and often. Generally, you should reapply every 2 hours. But water and sweat will make sunscreen less effective, and the effects depend on the strength of the sun and your skin tone, so you may want to reapply even more often. Sunscreen can expire too, so check the expiration date.
Some studies that were done in Boston have shown that just exposing the hands to about 20 minutes of sunlight is sufficient to produce enough vitamin D.
You can also get vitamin D from food and supplements. Ask your doctor if vitamin D supplements are right for you. And be sure to avoid tanning beds. These are very harmful to your skin and give you more of the damage with less of the benefits of sun exposure.
Tanning is not a good thing. So if you are tanning, that is one of the ways that your body responds to damage from the sun.
The sun is great, but it's undeniably powerful. Even though it's so far away, its effects are all around us, both good and bad. The best way to avoid sun damage is to limit your time in direct sunlight.
If your shadow is very short, then you should seek shade, because the sun is pretty much overhead and it's going through the smallest amount of the atmosphere. But later in the day, as your shadow gets longer, you would need less protection.
Cover up, embrace the shade, and wear sunscreen. Just like the effects of the sun, your future is closer than you think.
The sun is great, but Dr. Dieguez, no doubt that it kind of speeds up the aging process, right?
Absolutely, Olga. The problem with the sun is that it can cause the sun rays that you get from our daily sun exposure can cause premature aging and obviously damage that can even lead to skin cancer. And we will be speaking about this as the show continues.
That's right, and we want to stay as useful as possible. So we have some tips from the FDA. We have a graphic actually that takes a look at the bright side and the dark side of the sun. So let's take a look at that. And ladies, let's walk through it and see what we're learning here from this graphic. Do we have it if we can showcase it to our viewers? Here we go. So the bright side regulates sleep cycles, stimulates body's production of vitamin D. Dr. Dieguez, you want to maybe add something there?
Yes, absolutely. The vitamin D is very important in the absorption of major minerals that we need for our daily functions, including magnesium, calcium, and other biological effects.
All right, so now, Dr. Brewster, I'm going to take you to the dark side, yes?
Yes, the dark side.
Let's go to the dark side. Isn't that Star Wars or something? There you go. All right, so here comes the sun, the dark side. Wrinkles.
Wrinkles, age spots, freckles, discolorations, benign growths, and skin cancer. So definitely the sunshine is considered the biggest cause of visible aging. And if you haven't been savvy about protecting your skin in the past, it's never too late to start now.
And some people also develop what we call these spots on our arms, and some of them are white. What exactly are those?
Oh, you mean like the precancer cells?
Well, hopefully not, but you're just noticing some white and brown here.
Oh, well, sometimes your body can normally discolor a little bit.
That's right.
But definitely if the spots are changing or if they're growing, you definitely want to follow up with a dermatologist.
And we're going to talk more about that in just a few moments. Now let's kind of break it down and see certain things that we're doing and if we're doing enough of it. Water. Ladies, drinking enough water. Imperative, Dr. Dieguez?
Very imperative. It is very important for us to keep ourselves hydrated. Daily intake of large amounts of fluids and water are very important. And the reason why is because our skin needs to keep moist for our skin protection and obviously for our general overall good health.
A good question is how much water do you recommend? Sometimes you hear 6 ounces, or is it 6 8-ounce glasses of water?
Well, you know, my recommendations always for my patients is for you to drink between 6 to 8 cups of 8-ounce glasses of water, which will really, really help replenish and, you know, just overall keep your daily good health overall.
And to put it very PC, if you're going to the restroom and you notice that it's getting clearer and clearer, that's a good sign?
That could be a good sign, yes.
Did I say that appropriately?
Yes, you did, Olga.
Okay, let's move on to moisturizers. A lot of women are just like, not sure I really want to go for moisturizers. They're really expensive. A lot of them don't know which are the good ones. This is a good one, doctor? In terms of what it contains?
Yes, absolutely. You know, there are so many products right now out in the market. We, Dr. Brewster, as well as myself, we've reviewed many of them, and our recommendations are for you to go ahead. The 3 ingredients that you should always look for in your products are having hyaluronic acid, ceramides, and coconut oil, if you could believe that. It is actually excellent for the hydration and the skin moisture in your skin. But Dr. Brewster, as well as myself, we recommend for you to go to a website in the Skin Cancer Institute that you can go ahead and review all of the products, especially the ones that you are unclear about.
All right, and Dr. Brewster, let me bring you in. They say sometimes exposure to water can actually dry your skin. Is that correct?
Yes, that sometimes can happen by becoming overly damp. So definitely you want to limit your water exposure when you're taking a bath. Don't take 2 hot baths, because a warm bath is good enough.
What if we love taking hot showers? I mean, there's a lot of women out there saying, well, I'm in the shower for 15 minutes, it's nice and hot, and it relaxes.
Well, for me, going into the shower is actually getting away from my 3 kids.
There you go. I see
So long
personalized
showers are something we, but unfortunately we do not recommend that. And the reason why is because what we recommend is for you to take a shower that lasts between 5 to 10 minutes. And usually with warm water. Hot shower can really dry your skin, and it's not something that we recommend.
All right, we have to take a quick break, but we're also going to do a little show and tell here without the water and soap, I believe. We're going to kind of fake it till we make it here. But Dr. I believe Dieguez is going to show us how to wash our face. So stay tuned for that. And then we're also going to be sun smart, which is very important here in South Florida. So some tips coming up. So stay tuned for that. And please visit our website, allhealthallthetime.com, to submit questions for the doctor or to find out more about the Health Channel on South Florida PBS. We'll be right back.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with, it's different from a man and from a child. So there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions. Like how much vitamin A is good for you and how much is too much? If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Strength training is important for all of us, but when we're talking particularly about women, it becomes crucial, especially after menopause. If you think about how we use our muscles, we use our muscles for everything. We use them during our daily lives, to go to the grocery store, to carry our kids, to play with them, to do stuff around the house. The more we prepare our muscles for these activities and the more conditioned our muscles are, the better off we will be, and sometimes even prevent injuries from those daily activities. Also, after menopause, when we lose the protective effect of estrogen as the levels go down after menopause, then it becomes more important because strength training and resistance training can help maintain a healthier bone mineral density and sometimes even be a part of the treatment for osteopenia and osteoporosis. So I think resistance training for women is really important, it's critical.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverdi, and I'm with Dr. Michelle Brewster and Dr. Nina Dieguez, both internal medicine physicians with Baptist Health South Florida. All right, so let's continue the conversation. We're going to talk about certain skin cancers and how we can protect ourselves from there. But we want to do a little show and tell, if you will, a little lesson on how to wash your face. We obviously, ladies, don't have any water and soap, but Dr. Dieguez, through the magic of television, is going to show us how we should do it and why it's important. And how she's going to do this, I'm not sure.
Okay, so washing your face is very important because it does remove the excess oils, the germs, and the dead cells that we accumulate throughout our day. It is very important for us to continue washing our face on a daily basis. The American Academy of Dermatology is recommending for us to wash our face twice daily and with a mild, gentle cleanser, okay? So the way that we want you to go ahead and wash your faces with lukewarm, start off with lukewarm water. Wash your face thoroughly, then apply your gentle cleanser. When you apply your gentle cleanser, try to do massaging it in circular motions to get the entire area in your skin, okay, and in your face, and also include your neck as well. Once you do that, go ahead and wash all of the excess soap out of your face and your neck as well. It is very important, this next step. You get a clean cloth or a clean towel and pat dry your face. Do not rub your skin because this can cause irritation and dryness of your skin. And lastly, very importantly, after you go ahead and you wash your face, you want to go ahead and put on your moisturizer at this time because it will retain the moisture in your skin for a longer period of time.
Now that is the fabulous way of doing it. She has 3 children, so I'm seeing her pat, and wondering if she's really going, gotta go. Those things are not easy to do, but it's great advice. Practical for busy women, a little hard, but it can be done.
Absolutely, it is. You just have to, it is very important for you to put your routine, put the washing of the face and your daily routine into your morning episodes. Right before when you get up to go to, when you get out of bed, try to incorporate this in your daily activities.
Almost like we do breakfast and exercise and nutrition. Now, if you work outside or just enjoy being outside, we have a graphic with important ways to protect your skin. Let's look at that graphic real quick, and Dr. Brewster, let's walk through it. And use sunscreen, obviously, sit in shade, wear protective clothing. All of these are important, a couple?
All of them are absolutely important as a whole. So definitely using the sunscreen, as Nina was talking about, or as we were all talking about earlier, is important. And then the shade, because as you know, sometimes we can actually get sunburn in the shade. So even though you're in the shade, you have to wear sunscreen as well. And the other one was wearing protective clothing. There are different clothing brands that you can find on the Skin Cancer Foundation website that are recommended that have UV protection.
And now I want to get a little bit more technical in terms of ultraviolet light and how it damages the skin. So Dr. Brewster, explain to our viewers and kind of show me what we are seeing here and what it does to our skin. All
right, so we have 2 different solar lights, UVA and ultraviolet A and ultraviolet B lights, solar rays. The UVA penetrates through the skin, which we have 3 layers: epidermis, which is the top layer, middle layer is the dermis, and the hypodermis, and then the yellow area there is the fat. The UVA is very important because it actually penetrates the skin very deeply, which causes the signs of aging, like the wrinkles, the discolorations, and that type of thing. The UVB only penetrates the top layer, the epidermis, which causes sunburns. So both of them can definitely cause cancer, skin cancer.
And I have some, I'm sorry to interrupt you, doctor. I have some information on the Skin Cancer Foundation, which has designated May as Skin Cancer Awareness Month. And they say that 1 in 5 Americans will develop skin cancer by age 70. Wow, 1 in 5 by age 70, and more people are diagnosed with skin cancer each year than all other cancers combined. So let's walk through some certain cancers, and the most common and least aggressive form of skin cancer is basal cell carcinoma.
Yes.
We have a picture, I believe, of there it is right now. Doctor, what is it? How treatable is it?
It begins in the top skin of the top layer of the skin, the epidermis, and generally doesn't spread any further. It's easily treated. Celebrities like Hugh Jackman are afflicted with the basal cell carcinoma, and he's had several removed and gets checkups every 3 months with his dermatologist.
Which is important to do because not only does he have it, but we should also be checked by a dermatologist.
Absolutely.
The recommendation to be checked, doctor?
At least once a year.
Once a year.
If you have lesions, then you might have to go more frequently.
It's like a full body check, right?
Yes.
All right.
And you can do your own checking at home as well. You can. The Skin Counselor Foundation has a body map that you can mark your areas of concern.
Oh, okay.
And monitor them.
And watch them. And as you're watching them, since you brought that up, what do we do?
You check them once a month. And if it's changing, you have to follow up with your dermatologist.
Oh, great advice there. We have another image of squamous, am I saying that correctly? Squamous cell carcinoma. Dr.
Yes, squamous cell carcinoma is the second most common form of skin cancer. More than 1 million cases of squamous cell are diagnosed each year, resulting in more than 15,000 deaths. It's easily treated again. It can be excised and by the dermatologist and just followed up.
Is this the case with Bob Marley? Am I correct?
No, Bob Marley had a different type of skin cancer.
All right, so what skin cancer did he have?
He had melanoma, which is the most aggressive skin cancer. Bob Marley actually had a skin cancer in his toe, and he was actually recommended to have it removed, but because of his religion and because he feared physicians, he never had it removed, and unfortunately it spread everywhere and killed him. At age, I believe, 36, he died.
Yes, he was very young. This is obviously a very dangerous one.
Yes, this is the most dangerous, most aggressive.
And how do we notice if by chance, doctor, we have something like this?
Yeah, there are different ways that we'll get into. We have a graphic for that, the ABCDs of melanoma.
Let's take that if we can, the ABCDEs of melanoma. So we're going to take them in order. And the first one is, and we're going to bring that up for our viewers in just a bit. There we go. There's the A.
So warning signs of melanoma and what we have to look for. First of all, it's an acronym that healthcare professionals use for us to look at the warning signs and obviously for the patients to go ahead and seek further attention with their primary cares as well as their dermatologists. So the letter A stands for asymmetry. What this means is that we want you to draw an imaginary line through the lesion and match the left and the right side to make sure that both sides are even. If you see that both sides are not even, then this is definitely a warning sign.
All right, let's go through B now, which is border. Doctor, if you'd like to interject here.
Absolutely. So the most benign conditions, such as a mole, you will see that their borders are usually smooth and even. However, when you're thinking about a warning sign for possible melanoma, you will see that the borders are notched and they could be scalloped and just basically uneven. And this is definitely something that you could definitely visit your dermatologist to have it checked out.
All right, let's check out C, color. Why is color important here, doctor?
Color. So when you take a look at a benign lesion on your skin, the majority of the time, I would say most of the time, you will see that the color, the pigment throughout the entire lesion is the same color. You're not going to see a change in the color within the lesion. However, if you see any change in the color, such as red, white, or blue, these are also, and obviously hypopigmentations within the actual changes in the color within the lesion, these are warning signs for possible melanoma.
Moving on to D for diameter, and doctor?
Diameter. So most benign moles and lesions are usually smaller. We're not so concerned. However, when you see that you have a larger lesion that measures what we like to say as a 1/4 inch or greater than 6 millimeters, this is definitely a warning sign to Visit your dermatologist with concerns for possible melanoma.
And last but not least, E for evolving.
Evolving. So it is very important for you to take a look and monitor all the skin lesions that you have. Try to make sure that you can take pictures. Nowadays we're using so much iPhones and just regular phones with cameras. Take a picture of your lesion on your skin to make sure that it is not evolving or new ones are not popping up throughout your skin. Any change in size, color, elevation, or if you see that this lesion all of a sudden now is itching you, if it's causing crusting, at that point, visit your dermatologist.
And thank you for that explanation. That was fantastic. Thank you so much, Doctor. Dr. Brewster, early diagnosis then, really important to catch it.
Oh, yes. Most of these cancers are treatable if caught early. Unfortunately, if they're not caught later in stages, it can be sometimes too late. Specifically, a lot of people are not using sunscreen, and that puts them at risk for the development of skin cancer. So definitely you want to take care of yourself earlier, because preventive care is almost easier than taking care of it later when you actually have the disease.
Great information from both of you. Thank you so much. We're going to continue the conversation and ask, could you be at risk for skin cancer? Stay tuned to find out, and remember to visit our website, allhealthallthetime.com, to submit questions to the doctors and to find out more about the Health Channel right here on South Florida PBS. We'll be right back.
Migraines are pulsating headaches that often occur on one side of the head. If you suffer from migraines, you're familiar with the throbbing, one-sided pain that makes you sensitive to light and noise and causes nausea or vomiting. Some home remedies for migraine pain include changing your diet, monitoring triggers, scalp massages, using an ice pack, anti-inflammatory herbs like peppermint or chamomile, and staying hydrated. Contact your primary care physician about treatment options available to you today.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty, and if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school.
And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist,
or a coach, just like you.
Thank you for protecting my future.
Welcome Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and I'm with Dr. Michelle Brewster and Dr. Nina Dieguez, both internal medicine physicians with Baptist Health, South Florida. All right, so let's look at some risk factors. I believe we have a graphic, and I want to show that to my viewers, Doctor, and maybe explain to them what they're seeing in terms of skin cancer graphs. Do we have this? Yes. Fair skin.
Yes, just to be clear, anyone can get skin cancer, but definitely people that are at higher risk include people with fair skin, people with multiple moles or beauty marks, people with prior history of certain burns, and of course people who live in tropical addresses.
Like?
Like us.
Miami, Florida. So for everybody out there, you know, you always see people in the beach, Dr. Dieguez, and they come in and they're with their sunscreens, and you see somebody with a 30, someone with a 50. Which sun protection is one that you agree with, and what does it have to have?
Well, let's start off with what SPF stands for. SPF stands for sun protection factor. And the reality is that, just so everyone understands, because a lot of people don't realize this, how many minutes does it take for your skin to burn? For me, it usually takes me 20 minutes. For Michelle, maybe 15 minutes. And for you, Olga, it may be 30 minutes. Now, what we do with that, the SPF refers to time. The time that it takes for your skin from being damaged and being hurt from the rays of the sun. Now, what do? So you get, let's say myself, 20 minutes is what it takes me for me to start getting sunburned. You multiply this times 15 is the SPF that I usually use with my makeup in the morning, as mentioned earlier, and you multiply it times 15, and that gives you 5 hours of sun protection, okay? And this is 5 hours that, obviously, as we know, and we'll discuss later on, you do need to reapply. It all depends on the activities that you're doing.
That's a great way of putting it. So let's say I'm using a 30. I hear a lot of times that, or we hear a lot of times that 30 is enough. The higher the number, the better. At one point, is it all the same?
I do believe that after 50 SPF, more than 50, it really stops working. It is very important for, if you are going to do outdoor activities, for you to realize that, you know, you're gonna need more protection. For instance, like I said, I get up from bed, take a shower, I'm off to work, to the hospital. The reality is I don't have a lot of sun exposure, but it does protect me, that SPF 15. However, if it was a Saturday or a Sunday or a day that I have off and I'm enjoying an outdoor activity, I would, if I'm running, if I'm hiking, if I'm riding my bike, I would normally use 50. And even for my children, this is where the most I would use. And obviously, reapplication is the most important thing.
So let's get a 3-shot here of me with the ladies, because I'm going to do like a quick little test and see what they tell me. So I'm just going to give you the average mom out there and say, okay, she's now going to the soccer game with her kids and she's going to be there for a couple of hours. What SPF?
SPF 30 is fine.
SPF 30. All right. What about the runner or the jogger, Dr. Dieguez, that just wants to jog for 45 minutes every day?
I would probably use 30.
What about, let's say, a PE coach that's out there all day with the children?
50 would be the recommended amount.
What about just the average woman or man that just goes from home to the supermarket and to work and come back?
15.
15 would be what Dr. Brewster, as well as myself, would recommend, and that's what we both use daily.
Their makeup especially.
And then what we love the most in South Florida, which is on weekends, to be by the pool or to go to our fabulous beaches, and we're there all day barbecuing, all day having fun.
Definitely. You want to wear a higher and SPF 50 and reapply it after swimming.
Same applies for the children as oneself, because I see all the moms applying it on the kids, and then all of a sudden they're sitting back, they grab their book, and poof, they haven't applied it.
Right. Reapplication is very important. When you're swimming, if you're going into the water and swimming continuously for prolonged periods of time, take your children out, go ahead. The Academy of Dermatology, American Academy of Dermatology recommends for you to reapply it every 2 hours. However, as Olga was mentioning, you know, when you're with the kids, they're in the pool, you're going hiking, you're going swimming, and you know, you want to use and reapply every 2 hours, but you also want to use a higher SPF as mentioned.
Now, is it true that you should apply this before you go out, or can you just do it when you get there? A lot of people will just wait, apply it, and then woof, go in the water. Did you like that? Woof.
Well, yes. Well, it usually takes 20 minutes for the SPF and the lotion to be able to protect you and just basically absorb into your skin. So try to do it while you're at home, because it allows you, and not just that, you know, you just can't use it on your face, especially if you're going to be doing outdoors activities. You have to, you know, you have to place it all over your body, and that may take a lot longer.
Now, Denise, my producer, is telling me in my ear, you know, ask her about the makeup, ask her about the makeup. We know what you said about makeup. She wears, Denise, SPF 15 makeup. Does that apply for everyone, like Dr. Dieguez said, or should Denise or more
No,
add
it's
more?
fine. That's fine for regular daily use. That's fine. You can wash your face, put your moisturizer on, and then apply your makeup.
There you
fine.
go. So I just answered the question for my fabulous producer. She just said thank you.
Tell her welcome. Tell her welcome.
I have some cute little facts that I want to go over. I found them on my phone, and there are a lot of did you knows. So I wanted to share them with you, ladies. You can get a sunburn even on a cloudy day.
Yeah, like I was saying before, Olga, definitely when you're in the shade or in a cloudy day, the UV rays do penetrate, and they bounce off everywhere. So you always want to have sun protection when going outside.
Wearing a higher sunscreen, SPF, does not mean you don't need to reapply. You must reapply regardless of where you are. We talked about that. That's really important,
They
right,
recommend
Dr. Dieguez?
every 2 hours. And if you're going swimming, especially with the kids, I would even say hourly.
Hourly. Wow, okay. Even if you have that heavy duty one, the one that has a lizard on it.
It feels really greasy.
Because it takes so long to apply. And if women were to say to their children, more of the lizard necessary. Look at Dr. Dieguez, very serious. Yes.
You know what I recommend? Just be vigilant.
Yes.
That's what we recommend. I don't want you on the clock saying, oh, it's been an hour. Just keep, you know, and we'll talk about the UV index as well. That has a lot to do with it also. At the time that your kids are going swimming or that you're going swimming, all that plays an important role in this as well.
Here's another fun fact. Sunscreen does not prevent your body from making vitamin D. Interesting? You're still getting it.
Yes, that's true. The sunscreen, it's helpful, as we said, for protection of the UV, against the UV rays, but definitely your body is able to produce the vitamin D, which you need to make other minerals that we needed for a biologic function in the body.
And here's the big one and the final one, which affects all of us that are trying to still look good. So sun exposure, that would be me, by the way, not you ladies, you look fantastic. Sun exposure is responsible for up to 90% of the visible signs of aging.
It is the #1 cause.
Yes.
That's a lot.
Yes.
It really is.
The freckles, the wrinkles, the skin laxity.
So
Yes.
is it enough to put sunscreen, or should we now say, let's layer up, let's put the hat? A lot of people tend to apply sunscreen, take their time doing that, which is fantastic, by the way. Many of us need to learn to do that more. The hat, the long protective shirt. Yes, no, too much, overdoing it?
No, it's a cumulative situation. You want everything. You want the sunscreen, you want the hat, you want like a canvas hat with a broad rim that will protect your face, your ears, your neck. You also want sunglasses. The sunglasses help by protecting against development of cataracts and macular degeneration, which is both leading causes of vision loss in the elderly. So definitely glasses with UV protection is important. The hats, the clothing, the Skin Cancer Foundation website has a list of brands of clothing that they recommend with UV protection.
And they have that UV protection. Is that what it is? That
Yes.
they have something that bounces it off?
Yes, that reflects it off, yes.
And it's not, you know, for a lot of people that haven't used it, it's not heavy. A lot of people tend to think that it's just going to weigh them down and they dry up pretty quickly. Give me a little bit of explanation. They're really not that bad.
No, they're great. They're like a lot of clothing or a lot of activity activewear are made from the material that will reflect the UV lights, and they're also rated. They have the way the sunscreen is rated. They also have that as well for the clothing.
Now, Dr. Dieguez, you know that out there's probably someone saying, my gosh, that's a lot of stuff to do, you know? And no matter how much we enjoy the sun, and we do, and we live in South Florida, right? And Dr. Dieguez, you admitted to me that you love the sun.
I do. I definitely do. But already in almost reaching my mid-40s, it's something that we definitely have to take care of, especially not just because of the aging process that it is, as you mentioned, and you have the statistic, 90% of premature aging and of aging is due to the sun rays. And then it's not just that, as well as, you know, you need to take care of your skin because now we're entering into prevention, skin prevention. If we're able to localize and find these skin tags, these skin lesions that are evolving, as we mentioned, the A, B, C, Ds, and Es, we're able to prevent and treat and remove these potential skin cancers that can be deadly.
Fantastic information. Mid-40s. Wait till you hit 50. All right. So people tend to look great when they are tan, and they're using, of course, tanning beds. Are they safe for your skin? We kind of heard a little bit from that video before that may not be the best thing, but our experts are going to tell us why. And please visit our website, allhealthallthetime.com, to submit questions for the doctor or to find out more about the Health Channel on South Florida PBS. We'll be right back.
The Alter-G can be used for everything from athletic population, from young kids, high school, college, professional athletes, all the way to our older populations coming in with hip replacements, knee replacements. When you get into the treadmill, they wear a special spandex pants that has a zipper on it. You zip them in. When we turn on the treadmill, it fills up with air. It goes through a little process where it kind of gauges how much the patient weighs. It starts you at 100%, and then from there, we bring them down at that point.
I run track and cross country at St. Brennan, and my knee, I started getting knee pain in like January, so I stopped training and I started coming here. It's been good because I've been able to start running before I can actually get cleared, so it takes like the weight off my body, so it doesn't hurt as much when I run, and I can start running and getting used to like the motions and everything again before I can actually go out and train hard.
When the patient gets in it, usually they're always a little bit apprehensive, but in general, the patients usually like it a lot.
If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise. 30 minutes a day makes a big difference.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and I'm with the experts, Dr. Michelle Brewster and Dr. Nina Dieguez, both internal medicine physicians with Baptist Health, South Florida. All right, so we know that sunbathing isn't the only activity that requires sunscreen. There's a lot of people that love to go skiing with, without that sun protection, and probably they're thinking that if they're skiing and falling in the water, it's not as dangerous. But it's dangerous, isn't it, ladies?
Yes, it absolutely is. Going skiing can actually be even worse than laying in the sun for 8 to 10 hours.
Really?
Yes.
Why so?
Well, it has to do, the UV index is what we talked about earlier, is very important. That measures the amount of radiation that is hitting the surface of our Earth at the highest point of the sun. So this is, following this UV index is very important.
Because, and I'm glad you brought that up, to protect your skin in all climates, you need to check the ultraviolet or UV index. The Weather Service and the United States Environmental Protection Agency, they post information on their websites about the daily UV index. And let's break this down for our viewers and explain how to interpret this, Doctor.
Absolutely. So what we recommend, as Olga was mentioning, for you to log on to these websites, these 2 websites that we've given you in case one is down and the other one is not. You have one option or the other. So go ahead, and the numbers that we want to look at are from 0 to 10, above 10, as you can see in the graph. Minimal, which is minimal being between 0 and 2, which is a low risk of having the radiation and the damage to your skin. Then you go on, it escalates to between 3 and 4, which is a low risk. And then you have the moderate, 5 and 6, which already you're getting into a situation where you really, really should be wearing protection. And then followed by a high number, which is between 7 and 9. And obviously above 10, it is imperative for you to take care of yourself and take the precautions that Dr. Brewster, as well as myself, have informed you and wish for you to practice.
And I'm going to piggyback on that because viewers may be wondering, all right, so can't escape the sunshine here in South Florida. What is the best time that you recommend, Dr. Brewster, in terms of maybe not as dangerous? I mean, it's always dangerous, but the best time.
The best times are early morning or late afternoon. So the times that are more dangerous are the 10 a.m. to 4 p.m. That's when the rays are the strongest.
That's why we see a lot of moms a lot in the morning when they're walking their newborns or their babies for a stroll. It's usually early morning or later in the afternoon. Past what time?
After 4.
After 4 p.m., around 6, I see them a lot. So, sunburn in the shade. It can happen. You can be under a beautiful tree. You can be under one of those tents that the whole family gets together, and there is a nice young woman, maybe just looking at nature in the shade. Still can happen.
No, she needs to have that sunscreen on because the sun rays can bounce. The UV lights can bounce and then cause her to be sunburned. So definitely she should be having sunscreen whenever she goes out.
And now let's turn to tanning booths. A lot of people are using tanning booths. Your opinions on them? Do they damage the skin? Spray tans?
They're just as damaging. The tanning salons are just as damaging as the sun rays are. So a lot of states even prohibit people younger than 18 years old to even get them done. Brazil and Australia actually don't ban tanning salons altogether.
Really? They do?
Mm-hmm.
And Dr. Dieguez, I'm sure you see a lot of patients that will tell you, I'm going to go to a tanning booth, and your advice to them is?
Absolutely not. They're damaging, and what they do is cause premature aging and worsening of your skin. That is one thing, and we talked about it. Yes, we do. We live in South Florida. We enjoy the sun. Many times we've forgotten our sunscreen, but one thing that I definitely am against and do not recommend are suntan booths.
A safe alternative would be a spray tan, if you really want to have a tan.
And that spray tan would do what, and why is it better?
It's just coloring your skin as opposed to damaging the skin dermis. It's superficial as opposed to penetrating your skin, so that's fine.
And if somebody just says, well, I'm going to a party and I'm just going to go to the tanning booth one time because I want to look good for the weekend, or I want to look good for just this summer, not even one occasion, right, Dr. Dieguez? You seem really adamant against them,
I do. They really, you're getting high concentration of UVA rays, like Dr. Brewster was saying, when you're in the shade. The problem is that these rays, imagine all of us have seen waves. Those are what they are. What happens? These waves are not always vertical, and they could be vertical and they could be horizontal. And what happens? Imagine yourself having large amounts of UVA and UVB radiation hitting your skin at a very close proximity. This is, extremely dangerous.
I'm not sure if this is a fair question, but we hear about cancers. The awareness today is just amazing of what we need to do as people today, eating healthier, especially with exercise. You could correct me if I'm wrong, but this seems to be one that we can be proactive and possibly even prevent. I don't like using the word prevent, but it looks like it can be preventable. Your thoughts on that, doctor?
Absolutely. It's what we talked about. Just make it part of your daily routine. When I wake up, like I said, I wake up in the morning, I put on my SPF 15. Many times nowadays, you have makeup that is incorporated with, you have your moisturizers that are incorporated with the SPF 15s, and they actually are incorporated even on the makeup. So you want to go ahead and do this. You want to go ahead and take the precautions that you need, applying yourself as well as your children with protection, with shirts, with hats. All these things are just, it could be part of your daily routine, and it can really prevent and take care of your skin.
And we don't want to scare people, obviously, because we all understand the beauty of the sun, the beauty of nature, and the fabulous times that we as a family have with our children or our loved ones at the beach, at the pool. There are a lot of positives, as we said, with the sun. Dr. Dieguez, you were just telling me right now before we started this segment that with the last few days of rain, you've been?
I have. I've been on the. I've had no, I wouldn't say sour because I'm always smiling. I'm always very happy. But the reality is that for the last couple of days, it's been raining in South Florida every single day. And guess what? It does depress your mood.
It does.
I love seeing the sunshine.
And we were talking, Dr. Brewster, about places like London where beautiful, but it rains a little bit more than it does here. Seattle, those places, people.
They're not as happy as I think we would be here in South Florida having fun and the fun sunshine, but I definitely, I need sun to grow. I'm like a plant. I love sun and I like to be out there and it makes me happy. So you just have to be smart about it and take care of yourself.
So we have to recap here. We only have a few minutes left, but from what I gathered, I wanted to just go over 5 things that I felt were really important in what the doctor said. So let's recap together. And you two have been fantastic. I just really appreciate your time today. We've learned a lot.
You've been great.
Number one, limit the exposure.
Yes, definitely you want to limit your exposure to the sun and you want to protect yourself as well. Wear the right clothing, sunglasses, hat, and sunscreen.
Stay hydrated. Dr. Dieguez, that's a big one.
Yes, drink a lot of water. Try to keep your skin always moist, as you can develop the dry, scaly skin that we really, really want to advocate against.
And when you say keep the skin moist, we do that with what, doctor?
Moisturizing creams, hydrating ourselves very well, eating the right fruits and vegetables.
And we also have to, number 4, know your skin. I want you to amplify on that one because that's really important. Your skin is not like mine, and mine is not like yours, or anyone's out there?
Definitely. You want to always have check your skin out from head to toe once a month. There's a skin diagram that you can get from the Skin Counselor Foundation website that you can mark any suspicious lesions, and if they're changing in size, shape, color, you want to follow up with your dermatologist for that.
And speaking of dermatologist, the last one that I want to focus on is check your skin. You both can chime in on that. It's very important. Dr. Dieguez, I'm going to start with you.
Yes, absolutely. You know, the Skin Cancer Foundation recommends, as Dr. Brewster was saying, for you to receive monthly head-to-toe examinations. What are you going to look for? New lesions, a change in the actual lesion that you've been monitoring, and you can go ahead and download it's a body map that will actually you mark, and it's an actual body, and you put the mark of any mole, any birthmark, anything that concerns you. This is very important. Why? Because if there is evolving of these lesions, it will make you, and you will grow the concern enough to go ahead and speak to your dermatologist and visit them to voice your concerns and your doubts.
Ladies, this has been so fantastic. I'm actually going to put Dr. Brewster on the spot again, because since she sang with me at the beginning of the show, I'm going to see if she remembers a song from John Denver.
Denver, okay.
Sunshine on my shoulders.
Oh.
Makes me happy.
Oh, Dieguez knows it. I got Dieguez to chime in.
It was quick. It was quick. It was quick of you.
Thank you so much.
You've been wonderful. Thank you so much.
Thank you for having us.
That's all the time we have. So thank you so much for joining us today on the Health Channel. All Health, all the time. Remember to check out our website, allhealthallthetime.com. And have a little bit of sunshine on your shoulders today. Oh my gosh, they're hugging. Look how fantastic. Can we show this? Oh, a big hug. One more time. See you later. One more hug. One more hug. Oh.
I told Jen.